Well, I've had the flu vaccine and I think it's important for various reasons. One is to protect your own health, but I'd appeal to staff that even if they're not too pushed about their own health, to think about two other considerations. The first is think about their patients. So for example, I work in maternity where we look after a lot of pregnant women and their small newborn babies who are particularly vulnerable to flu. And of course a lot of staff in the NHS will work with vulnerable patient groups. So if for no other reason, please consider having the vaccine just to protect your patients. The other important consideration, of course, is to consider what happens to your staffing levels if there is a flu pandemic. You know yourself what it's like trying to deal with a busy ward when you're down one or two members of staff. Consider the situation where half of the staff who haven't been vaccinated are off at the same time, at a time when the hospital is particularly busy. So for those reasons alone, if not for your own health, please have the vaccine.
I think it's very important that the NHS staff have their flu vaccine, because if we contracted the flu vaccine, especially those that work on the ambulances, it would ultimately mean there'd be less ambulances on the road to help people when they called 999 asking for help.
I think it's really important to get the flu vaccination because we have to look after ourselves and protect ourselves. Clearly we're at the front line and the sick patients with flu will be coming to hospital, and so we're therefore at high risk of being exposed, and so we need to look after ourselves and obviously by definition looking after our family, because we can then pass on the bugs to them.
It is important that you come and have the flu jab this autumn. The vaccine is safe, effective and cannot give you flu. It will help prevent you getting ill this winter.
Well, I'm a children's doctor, so from a children's perspective, I've been having my jab every year. It hardly hurt. And I've seen children go to intensive care and be very sick with flu, and I would hate to think that I was carrying an infection that I might give a vulnerable child or even bring home to my family. I've got children myself, so it's so easy to do. That's why I've done it every year.
I think it's important to have the flu vaccine because on a daily basis we're coming into contact with viruses and germs in the environment, and it's important to have this vaccine in order to protect ourselves, the patients we're dealing with and our families.